I'm Dr. Lisa Casey. I am the Program Director for the new Family Medicine Residency Program at Tammany Health System. I know that this program will give you the best training in both the inpatient and outpatient setting, and we'll do it in a state-of-the-art hospital and a brand new family medicine clinic.
Tammany Health System has a very robust strategic planning process. And about 5 years ago, we really embarked on the journey to become a family medicine graduate medical education site. We're very fortunate that our partner, Ochsner Health, has served as the sponsoring institution for this amazing program.
I think the residency partnering with Ochsner Health has the benefit of having an established organization with over 30 specialties, including subspecialties, sim lab, and just a very big geographic pool for patients for diverse education.
There are no other residents in the hospital. This will be the sole focus of our hospital, so family medicine residents are going to be unopposed, and you are going to have your first chance opportunity on every patient case, every procedure that you want to fulfill your own needs, your own goals, and the skills that you want to obtain during your training.
The residency itself has its own building and its own kind of home that I feel like is very unique to the residency, but it's within a system that has a ton of resources, a lot of specialists, so the residents get to work directly with the specialist, which is a very awesome kind of opportunity for them. And then even in the hospital, they're the only residents there, so they get to see a lot of things firsthand.
That we have a lot to offer here at St. Tammany. It's a unique and special community. It's a very successful hospital that is totally committed to training the future generation of physicians through our family medicine residency. We have a committed and very expert medical faculty that's excited and eager about the opportunity to teach and provide training for the future generation of residents, and full commitment on the part of the executive team and the board to making this a successful venture.
One of the things that I've loved so far is that being at a brand new program, we get a lot of one-on-one time with our preceptors, and all of them really enjoy teaching. So anytime we have questions, we really take the time to dive deep into topics to understand the why behind what we're doing, and I find that that's helped me so much in the clinic setting as well as in the outpatient and inpatient settings.
So getting to work with each of them and understanding how they approach patient care has been such a blessing. Seeing different directions and different avenues you can take to care, and seeing just how big of a difference you really can make in somebody's life has been the greatest joy.
I'm passionate about family medicine. I'm passionate about teaching residents. They share my passion for this. It's where we find our purpose, and it's passion and purpose that we hope to instill in you.
I've had the pleasure of working with family medicine residents since 2012, and I joined this team as an opportunity to work in my own community of St. Tammany Parish.
What I love the most about family medicine is that you're able to follow families from the youngest all the way up through the most elderly population, and really getting to see the family transition and taking care of them through every step of the way, the good and the bad. And I grew up taking care of my great-grandmother. She had early onset dementia, and my family took care of her from the time she got the disease all the way through hospice. And that was really what inspired me to go into family medicine, was that process.
One of the things I love about family medicine is that I can practice as broadly or as narrowly as I want. There's so many different opportunities, and the opportunity to change what I want to do throughout my career.
Some of my favorite things are continuity of care, so being able to take care of a patient and really build that patient-physician relationship in a meaningful way. I also love being able to take care of multi-generations.
A safe experience where they can feel free to ask questions, feel free to get things wrong, because that's what residency is about. I think we just want to make sure that they feel supported, and they're also learning everything that they can in this period of time that's very overwhelming and can be kind of daunting.
I want to help train great physicians to help take care of our community.
Both residents and medical students give you a nice, fresh perspective, I think, on pretty much everything.
Really just an exciting thing to kind of help watch them grow, and then I think also it continues to push me to be better and continues to make me stay up to date and helps me grow as well.
During the time that we spend on inpatient medicine, sitting down and having conversations about patients and all of the avenues and directions that we need to address to take care of them in the hospital has been the biggest milestone, I think, of crossing. A lot of education during that particular time, from disease standpoint, from patient care standpoint, from all types of social avenues and other things that you may not think think about when caring for somebody in the hospital.
One of my most memorable patient experiences so far was being in the inpatient setting and getting to introduce myself to a patient who was going through something that wasn't great. They're in the hospital, not in a comfortable environment, and getting to be able to comfort them and building a relationship with someone, and then being able to follow that through with continuity in the clinic, and having my own patience and responsibility of taking care of that person has been something that I've dreamed about for a long time and has come to fruition here, and I've really enjoyed it so far.
I actually wanted to become a faculty position after I started teaching medical students. It energized me and made me excited to teach, and so I wanted to do that in a more impactful and complete way.
We're teaching each other. A lot of times I learn from my students just as much as they learn from me.
But by far my favorite part is working right alongside residents while they see their patients and provide an embedded care.
I'm excited about building relationships with you. In near 27 years of practice, I've treated over 100,000 patients. I've cherished the relationships with the patients, but I also cherish the relationships with Lisa Casey, Catherine Pichon, and Gabby Givens. What a rock star faculty that I'm privileged to be a part of.
The faculty that I have been working with is so supportive and really just fun to be around. I feel like I'm already asking them a ton of questions and they don't make me feel silly for asking questions. It's just been a really great group to be a part of, and I'm excited to kind of see where we can take the program together.
All of the nurses have been very encouraging and definitely also want to help you in any way possible. And all of the attendings from every specialty you can imagine have definitely embraced the journey with us, and they are welcome to open to all of our questions and concerns.
And what really inspired me to choose St. Tammany as a family medicine program is that they embrace that community aspect of how families are so integrated here, and they treat you like a family as well as part of the residency. And the faculty here is very supportive and inclusive.
St. Tammany Health System is an amazing academic environment. Our team here of 2,600 colleagues and over 600 medical staff leaders have really come together to create a high-performing environment that strives for that journey to high reliability.
We've developed a pretty sophisticated healthcare delivery system with the ability to offer a lot of services that are really beyond what a usual community hospital is able to offer.
We have a plethora of medical conditions. Those things that you thought you'd never see when they told you in medical school, those don't exist anymore, they're here. You're going to get those complicated patients.
We have robotic surgery here, we have laparoscopic surgery, we have vaginal surgery, pretty much the whole gamut of GYN and GYN oncology.
So you'll have a really good breadth of the common stuff that you'll see, but like I said, we do get zebras that come through the door as well. And I think what's really unique about the family medicine residents training here is that they get the experience of taking care of pediatric ICU patients as well, which is very unusual.
One of the unique opportunities we have in starting a new program is the ability to innovate. I'm looking at places like lifestyle medicine, obesity medicine, community medicine, all opportunities we have to make a difference in our community and change outcomes for our patients.
Something that really drew me to this program was the opportunity to get board certified in lifestyle medicine, especially because there's no other programs in Louisiana like this, and it really gives the opportunity to dive into preventative care with patients, which is really important to me.
We have a very special opportunity with a unique circumstance in that we have an outstanding community here on the North Shore of Lake Pontchartrain in St. Tammany Parish, and we have an outstanding hospital, St. Tammany Health System, that has grown up around serving the needs of this community.
St. Tammany as a whole, as a parish, it was one of the best places that we used to go to on the weekends just growing up. So coming back home, so to speak, has been definitely a blessing.
There was just no other place that I could see myself working, and St. Tammany is actually a place where I personally received medical care, so I knew what wonderful and excellent medical care was practiced here, and so it filled me with joy to be able to come back home and practice in my own hometown.
St. Tammany is a great place for a family medicine residency because it's a great hospital. It's a great place to work.
From the scrub techs to the nurses to the anesthesia to the nurse anesthetist to the person cleaning the floor. I mean, everybody's pretty happy to be here.
I've been part of this organization for close to 20 years now. I've seen drastic changes for the positive within the health system and for the community as a whole. But as said by our boss, our CEO, Joan Kaufman, it's the culture that separates us here.
So St. Tammany is such a wonderful place to practice, and it's going to be a wonderful place to train as well. It's such a collegial and family-friendly atmosphere. Everybody truly treats you as family.
The nurses are happy here, the docs are happy here.
We feel very comfortable with each other. We're comfortable with our colleagues. It's a great environment to work. People come here and stay here, which says a lot.
What I love most about my hospital specifically is that we do have that collegiality, we do have that communication, and it helps provide better care, also makes work a lot more fun.
There's a really great work-life balance, especially for someone who's interested in starting a family. I find that they've taken into consideration our needs and really built a program that allows us to enjoy our life but also enjoy our work.
Not only is St. Tammany a great place to work, the community is a great place to live. I raised my family here, the schools are great, it's safe, there's a lot of downtown activities.
Louisiana is known as the sportsman's paradise, so there's a lot of outdoor activities. I personally love to go jogging at the lakefront, biking on the St. Tammany Trace. I like walking my dogs at the lakefront. It really makes for an enjoyable atmosphere, and there's plenty to do. There's great food, great culture, great people. It's a wonderful place to live.
St. Tammany Health System has been on a trajectory for remarkable levels of success over the past few years. And this new phase of becoming a teaching hospital is really an exciting next step for us in terms of our continued evolution and ability to serve the community.
Our goal for the residents of this program is to develop a love of family medicine, a passion for treating patients, in addition to gaining the medical knowledge that it takes to be a great family medicine physician.
Getting to see my patients on a weekly or monthly basis, depending on exactly how long I need to see them between visits, has been great. So I know exactly what's going on. I'm able to understand because I'm the one who took care of them before. I know exactly the decision making and why I did things the way that I did. And we're forming those types of relationships with people in the community that really need them. And it's been fascinating to just get to know them and have them also introduced to our faculty and working together as a team collectively. It's been really fun.
The biggest benefit to this program is you're gonna be able to participate in anything that you really want to participate in.
We want them to recognize a sick kid from a well kid, whether they're going to be in a hospital or working in the clinic, and I think they're going to be able to learn that skill here.
My goal for you when you graduate family medicine residency is that you have the confidence and competence to practice full scope family medicine in however you choose to.
My hope for the residents when they graduate is they pick up a number of the behavioral health tools to be able to use in their career going forward. There aren't always opportunities to refer out for behavioral health. Our family medicine doctors have that good, strong relationship through continuity of care to be able to use that relationship over time and use the tools that we have that are empirically supported to best help their patients.
Because of the number of services offered here at St. Tammany, your training will be extensive. You will be able to leave here as the best family practice physician you can be.
My goal for the residents that graduate our program are to be so well trained that I would feel comfortable sending my own family members to them.
We're building something new from the ground up. So being part of groundbreaking things and deciding exactly how and what we want to do going forward and setting the stage for future residents has been one of the greatest joys.
If you have a love of family medicine and a pioneering spirit, join us.